National Jewish and University Hospital are two separate institutions in the Denver metro area that serve different populations but have a lot of overlap in terms of faculty, research opportunities, and learning opportunities for a lot of our fellows.
We established this fellowship over 30 years ago with the precise goal of giving thoracic fellows exposure to both common lung diseases and less common lung diseases, as well as the spectrum of cardiac diseases.
One of the unique things about our fellowship is that it is the only cardiothoracic imaging fellowship in the state of Colorado, and it is the one of few in the mountain region for cardiothoracic imaging.
The fellow rotates between National Jewish Health and University of Colorado Health, and at each institution they spend a month in rotation. That's the strength of this program. The month gives them adequate time to really acclimatize and immerse themselves in the very different experiences.
The University of Colorado itself is a trauma center, a transplant center, cancer center, and is able to offer fellows a lot of variety in terms of acute and ambulatory care.
Our cardiac MRI volume keeps growing. It's been growing consistently over the past 8 years, and we're currently doing over 1,200 cardiac MRIs every year.
At National Jewish, on a day-to-day basis, we see just so much interstitial lung disease. Remember, as a resident, you hear UIP, NSIP, DIP, you read about all these things and you see it in the textbooks, but here we have 10 doctors just dedicated to interstitial lung disease, pulmonologists, so that in and of itself, you're going to be getting, decent volume.
Our clinical staff are recognized as national and world experts. And so as radiologists working with these clinicians and being able to assist in these cases, it is an incredibly rewarding experience.
The fact that we have a wide breadth of faculty members across differing divisions and departments coming together, I think is an amazing attribute to the program here, and really allows you to learn from many different facets about cardiac imaging from different specialists.
Those of you interested in this program, you know David Lynch. This guy is world-renowned in terms of diffuse lung disease. He is a fantastic mentor.
So I work with each of the fellows on a one-on-one basis, mentoring them through both common diagnoses and uncommon diagnoses. We focus very much here on making our reports of value to sophisticated pulmonary clinicians.
And so a real strength of our program, and particularly for radiologists, is that we are radiologist-led. Our lung cancer screening program resides within radiology.
Throughout the week, the fellow will participate of multiple multidisciplinary conferences with other specialties. These include a thoracic tumor board, an aortic imaging conference, chronic thromboembolic pulmonary hypertension conference, and airway conference.
A nice example of one of our multidisciplinary conferences is our lung tumor conference, which is followed by our suspicious nodule conference. This conference includes the pulmonologist, the interventional pulmonologist, the oncologist, radiation oncologist, surgeon, radiologist. So having that kind of environment where you've got all the people in the room that are important to be able to determine what the next best step is just so critical.
The field of cardiac CT is just simply growing because of the technology. We have been involved with FFR CT from the outset. In terms of new equipment, we'll be putting in a new Siemens Force scanner within the next week.
I was actually a fellow here from 2018 to 2019, and then I subsequently joined on faculty here at National Jewish. You get this broad scope of pathology, whether it's private practice in the community setting versus, a very highly specialized academic setting. You're gonna see it all, and you're gonna be really, really comfortable once you're done with this fellowship.
My formula when I was looking for programs is one, Are they an outstanding clinical program? Do they have the resources? Will I learn what I need to learn? And the answer for University of Colorado Hospital is the absolute answer is yes. The next piece on my list was location. And Denver is a fantastic place to be. There are just fantastic opportunities to explore in the Denver metro area, both within the city as well as the mountains.
I feel fortunate that I've been able to be in Denver for residency, for fellowship, and now staying on as faculty. We have a number of people in our group who have done at least a portion of their training here, and I think it's really a testament to Denver being a great place to live and both of these institutions being great places to work that people have chosen to stay here after graduation.
We hope that you strongly consider our program. I think it really is one of the most unique and strong programs in the country. Thanks.